Take a seat. How are you today? Good, good. Well, my name's Sarah, and I'm the doctor that's going to be performing your allergy testing today. Okay, now I'm just going to go through a few basic things first. Okay, just your name, address, and some basic details, if that's okay. Just going to have a quick look through previous notes for you. All right, okay. So, can you just confirm your name for me? Okay, that's right. And your date of birth. Okay, that's good. Now I can see that you've previously had some allergy testing performed, but you've more recently had a few new symptoms, is that correct? Yeah, okay. I've just got some details from your GP referral in front of me, so that's helpful. Okay. I just need to ask you a couple of questions relating to your allergies that you're getting at the moment. Do you frequently have puffy eyes, itchy eyes, wrinkles, dark circles? Yeah, okay. Do your eyes water and burn as well? Yeah, okay. And do you find that your nose gets itchy, you sneeze, and your nose gets runny? Yeah, okay. Okay. Do you often feel like you have a cold, but you actually don't have a cold? It's more like the nasal congestion symptoms? Yeah, okay. And I've also got a note that you've been experiencing some skin problems as well, is that correct? Okay, so have you been getting rashes or hives, which are raised itchy bumps? Right, so you've been getting some bumps. And you've had a faint rash. Where was the rash? Okay, on your face, all right. Does that coincide with the itchy eyes, etc.? Not necessarily, okay. All right. Do you ever get any swelling of your lips or tongue, anything like that? No. Okay. Right. Are you currently having any symptoms? Right, okay, so there's a little patch on your face there. Yeah, okay. And you've got, okay, your eyes are a little bit itchy and your nose is a little bit tingly. Right. Do you get itching inside of your ears at all? Okay. And do you get asthma? Okay, that's fine. Alright. Okay, before I start the allergy testing, I will just have a little look at the couple of areas that you've got problems with at the moment, if that's okay. I'll just be looking with a light and a special magnifying glass. Yeah. Okay. Right. Just need to pop my gloves on. Of course, we're heading towards allergy seasons now, aren't we? people are starting to mow lawns and blossoms are in bloom and the flowers are coming out. So, you know, this time of year a lot of people start to get allergies. But anyway, we'll see what's going on. So, firstly, let me just wipe the area, okay? Okay, it's fine. I'm just going to clean a little area on your chest as well. Okay. I can see you've got a few bumps there as well, haven't you? Okay, just show me your arms 1 second. Okay, let's have a look at your right arm. Okay. The surface of your skin does look a little bit bumpy there and a little bit red. Does that itch at all? Yeah. Okay, let's have a look at this side. Okay. And the same on this side too. Okay. So that's all cleansed. Alright. So, if you just sit nice and still for me, I'm just going to have a look closely at this area on your face. Okay. 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 Yeah. I'll just check this side as well. Okay. Okay. And I'll just have a little close look at your arms with this, okay? Okay. And I'll just have a little look at your chest, just in that area where I'm going to be putting some patch test discs on. But this is where you've got some bumps, a little bit of rash. Okay. Lovely. Thank you. All right. So, the first test I'm going to do for you today is the pinprick test. Okay, and I'm going to be looking at allergens, sort of like pollens and pet dander, mold spores, and that's going to be done on your forearm. Okay, I'll do that test first because we could get the results pretty quickly from that. Okay, and the other test that I'll be doing, I'll be putting some discs onto your chest with tape, and they'll be impregnated with allergens also. And that needs to stay on for around 48 hours, I'm afraid, to get a reaction. And I'll be looking at things like perfumes, additives that could be in fabric softeners, you know, washing powders. And also things like, you know, in all your metals, okay, so nickel allergy, things like that, things that would be in contact perhaps with your skin. Yeah. Okay. I mean, you may have an idea of what it is that's aggravating you, but sometimes there can be other things as well. I mean, I've got on my notes that you're not having any tummy issues, so I'm not too concerned that it's actually going to be something that you're ingesting at this point. If these tests don't show anything, and of course we can look at other allergens, but I think for now I'm going to concentrate on things that, you know, are irritating your nasal passages, your eyes, okay, and also things that are in contact with your skin. Okay, are you comfortable with that? Do you have any questions before we start? Okay. Now, the pinprick test isn't painful. It's a very, very small lancet that I use just to put over the area of allergen that I've put on your skin. Okay. Firstly, I need to mark out your skin with a pen, just so we know what's what. Okay. Are you happy with that? If at any point you do feel uncomfortable. Okay. Now, you've not taken any antihistamine tablets in the past 24 hours, have you? No, that's good. That's good. Because obviously that could give us a false result. You're not taking any digestive medicines such as ranitidine or cimetidine? No. Okay. And you're not taking Xolair for asthma, are you? No, because you're not asthmatic. That's fine, because all these things can actually give false results. Okay. So you're clear on that. That's super. Okay, so you just relax now, just get everything ready for the tests. Okay, thank you. Okay then, so I'm just going to give the areas another little wipe. So let's just wipe your forearm there. Okay, and just going to wipe the chest again. Okay, and it's not made it itch worse, has it, using the wipe? No, that's fine. So I need to just draw a few marks on your chest and on your arm, if that's okay. Great, thank you. There we go. And on your chest. Just mark that out there. There. So as I said to you, the first test I'm going to do today is the pinprick test on your forearm, because we should get quite instant results with that. Okay? So keep your arm nice and relaxed and outstretched for me. I'm just going to be putting drops of allergens onto the areas that I've marked out, and then I'll just be using a very small lancet just to dot into the skin to get that allergen under the skin. Okay? Alright. So let's go with the first one. Okay, and there we go. That's the first one. Okay, and you ready? Just going to do a little dot, and 1, 2, 3. There we go. That's super. The next allergen. Okay, and there we go. Just get a new lancet. We have to use obviously a new lancet for each allergen, so there's no cross-contamination there. So dot again, okay? There we go. Well done. Here's the third one. Get a new lancet. Okay, and third lancet. You're doing really well. Is it feeling okay? Good. And this is the last one of the pinprick tests. You'll be glad to know. Okay, just put that on there. Okay, new lancet. Alright, and there. Okay, let's pop that in the sharps box over there. Alright, I'm just going to take a look at those for a second, if that's okay with you. All right. Okay. Right. Now for the second test, there'll be some little discs that I'm going to tape onto your chest in the areas that I've marked out, okay, with the allergens on that I'm testing for. So again, this isn't going to be uncomfortable, but you will have to keep them on for 48 hours and then come back and see us. Okay. So these are the discs. Okay. And it'll just be some surgical tape that holds these onto your chest. Okay. So I have to impregnate each disc and then attach it to your chest in the marked areas. Okay. That one. So let's just get some tape. Okay. There we go. Okay, so here's this one. It's going to go on your chest here. Okay. Alright. There. Okay. Super. That's the first one. Is that feeling okay? Good. And how is your arm feeling? Oh, it's feeling a little itchy. Okay, well, it looks like we could be getting a reaction there, so let's just do this next one. Okay. Alright. It's number 2. There we go. Okay. Just need to get my other allergen bottle. There we go. I'll do this one here actually. Okay. This one. this is the final one for your chest. Okay. Oh, it's not as bad as you thought. That's good. I think the worst bit is the pinprick. Not that it's painful, but you're just a little bit aware of it. But that's all done now. Okay. So that's that one. This is number 4. Okay. Alright. So I just need to add a little bit of extra tape, okay, onto this, just to make sure it's all held in place. Okay, and taped up good and proper now, aren't you? And one more piece. Okay, let's pop that on there. Okay, well, I'm happy with that. Just jot a couple of things. Okay. So how's that arm feeling? Yeah, okay. Well, it's almost ready for me to check. So I just got to make a little note ready on there on my chart. Okay. Right, so let's have a look at it then. Okay. Okay. I'm just going to shine my light over this. Okay. All right. Okay. Right. Well, it looks like you've got an allergy to grass pollen. Okay. Let's see what else has shown up. Yeah. Pet dander. So, do you have any pets? Okay, so you've recently got a dog. Okay, well, that might be worth investigating further, because it could be that it's your new friend that's triggering some of these problems. Definitely pet dander. Okay. And what else? Okay. You're clear for mould spores. That's not shown up. It is showing a reaction to dust mites though, which is a very, very common allergy. our homes are full of dust, okay? Even when you dust the house and wipe it down, you know, you get lots of dust mites, and it's very important to vacuum your mattress and pillows regularly, because obviously this is where dust mites love to thrive, and you sleep in it, and it can trigger obviously a lot of allergies, sinus allergies, itchy eyes, that kind of thing, and it's in some people asthma too. Okay. All right. Is that feeling a little itchy? Yeah. Okay. Is anything itching already under your chest? Okay. This can take a little while. Okay. Some people have a very quick reaction, which leaves like a lump, which is a very rapid urticarial reaction. But I can't see that happening just yet. But over 48 hours, something could happen there. Okay. Yeah. All right. So, next steps. You can go home now. All right. Call us if there's any problems. Okay. If you start to get what you feel is a more severe reaction, all we'd ask is that you tolerate the reaction that you're getting under your pads there on your chest, if that's okay, and try not to take any medications, obviously, because that can inhibit the true results. I've got notes now on what your pinprick tests have shown, so I'll update that on the report, and then when you come back in a couple of days' time, we'll be able to give a bigger picture there, and hopefully we can tell you what things you need to avoid with contact with your skin. It's quite often things like nickel that causes problems there, or certain things in washing liquids, washing fabric, conditioners and things like that, and sometimes even the soaps that we use on our face. Yeah. Okay, well, thank you for coming in today. And I can see you've got your appointment made for 2 days' time, so I'll see you then and we'll take a look at it for you. Okay then. Nice to see you. Take care. Bye-bye. Oh, hi there. How are you today? Oh, take a seat. I can see your eyes are looking really red and sore, aren't they? Okay, we'll just take a seat a second. I'll just check your notes. Our computer systems aren't working properly today, so we managed to print off some of your recent notes, and I'll just check through those, make sure I've got the correct details, if that's okay. Okay. So just confirm your name for me. All right, that's great. And date of birth. Okay. That's fine. I think before we go any further, there we go. I think you need a tissue for your eyes, don't you? There we go. Good. There's plenty more if you want some more. Okay. And your current contact number? Yeah, that's fine. Okay, let me just have a little look through here. Okay, so we've not seen you for a little while, have we? Okay, which is always a good thing if you've been feeling fine. Okay, so I'm guessing that you're visiting me today because of your eyes and nose, I'm guessing, because you sound quite snuffly. Yeah. Okay. So what's been going on with those? Okay. So your eyes are itchy. Okay, and very watery. Okay. And they feel sore too. Okay. Do they feel like there's grit in them? No? Itchy? Okay. So this is gritty and itchy. Yeah, that's fine. Okay. With your nose, are you sneezing? Yeah, okay. And your nose is quite runny at the same time. Yeah, okay. How's your throat feeling? Scratchy. Okay, not scratchy. Okay, any cough? All right. That kind of tickly cough may just be due to mucus from the nose in the back of the throat, okay? This is all leaning towards you having an allergy, and given the time of year, it certainly looks and sounds like you have hay fever. Have you had hay fever in the past? Okay, so it was childhood, but then it cleared up. Okay, what age did that clear? Okay, so we're about 18, and this is your first episode since. Okay, all right, okay, and your current age is 34. All right. Okay, have you got any ear pain at all? No, but your ears feel a little bit itchy. Yeah. Okay. Alrighty. Well, I think we just need to have a closer look in those eyes, don't we? And have a little look in your throat. Okay, have a feel around. I'll check your blood pressure while you're here as well. Yeah. Okay. You've been getting headaches too, okay. Do you feel congested? Yeah. Okay, well that'll be due to the congestion there with the allergies, I'm sure. It can be treated in a number of ways. So we'll have a look and we'll see what's going to be best for you. Okay? All right. Well, let me check your blood pressure first. Okay. So I'll just be putting the cuff on your arms. I'll do each arm and inflating the cuff. Okay? All right. You've had it done many times. Yeah. So you know what to expect. Okay. So let's get the cuff on your left arm. Outstretch that arm nicely for me there. That's great. Okay. All right. Okay. Just place my stethoscope on your arm there, and I'll inflate the cuff. Okay, that's good. Remove that. Okay. And let's move over to your right arm and we'll check that one. Okay. Outstretch your arm for me. Thank you. Go and round. Okay. Just place my stethoscope on your arm again and we'll inflate the cuff. Super. Well, your blood pressure is 122/83, and that's perfectly healthy. So that's what we like to see. Okay. So, I'm going to get some gloves on and have a look around your eyes, in your eyes with the light. I'll have a little look at your nose and in your throat as well. Okay. We always want the nice weather, don't we? And then when it arrives, it brings all these allergies with it. So I'm just going to put my gloves on. Got some nice new comfy gloves now. These are great. Everybody was complaining about the last ones. Okay. So, I'm just going to have a little look in your eye at first without a light, just a little visual check. So just look straight ahead at me if that's okay. Thank you. I'm just going to pull the eye down there. Okay. Alright, let's have a look at this side. Yeah, they're slightly puffy underneath, aren't they, as well? Okay, yeah, there's a lot of redness in there, which is not very visible anyway, but they're very, very irritated. But I did notice when you were sitting here at first, you were rubbing your eyes. Please don't rub them. I know it's really difficult because they're so irritated, but by rubbing them, you actually only make things feel worse, and the redness can get worse, and you run the risk of getting infection in your eyes as well if you put in your hands by your eyes, particularly when they're already irritated. So once they're starting to feel better, when we've given you some medication for them, you will have less urge to rub them. Okay, but it's good to bathe them as well. Just bathe them in some cool water, and that will make them feel a lot better as well, rather than you rubbing away at them there. Okay, so if you just look straight ahead for me, I'm just going to have a look into each eye with this light. Okay, alrighty, and okay. Keep looking at my nose, thank you. That's not hurting your eyes, is it at all? No. Okay. Alright. Okay, and let's try this side. I'm just looking in that left eye. This one looks particularly sore. Yeah. Okay. Okay. I'll get you a tissue here because they're a bit watery on it. Let's just give those a gentle dab underneath. And don't rub your eyes with tissues either, just give them a little dab, just like I have there. Dab, 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 dab. Dab, 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 dab. Okay. Alright. So I just want to have a look in your throat. I'm happy that this is an allergy as opposed to anything else, because it doesn't feel like a cold, does it, to you? No, you haven't got those other symptoms. So okay, let's have a look. Put my light on again, and I'm just going to depress the tongue slightly, open nice and wide for me. Okay, there we go. And I'm just going to have a look in your throat. Can you say "ah" for me? Okay, and again. Okay. Okay, just going to move that a little bit there. Okay, and just to be sure, just say "ah" to me one more time. Okay, great. Okay. Okay, good. I'll just write a few notes there. So I can't see any real irritation in the throat. The itchiness will be from that mucus, which tends to make it quite tickly. The prickly sensations arise from the allergy as well. Okay. And I'll have a little listen to your chest, if that's okay. Okay, so just to undo your shirt a little bit there for me. That's great, thank you. You okay there? Good. Okay, so just gonna have a little listen there. Okay, can you just take a nice deep breath in for me? Okay, and out. Okay, and again for me. Good, and again. And one more time. Great, okay. And can you give me a little cough, type of cough, okay? And round the back, cough again for me, okay? And another deep breath. Lovely. On this side, okay, little cough. And a deep breath. Okay, and breathe normally for me. Okay. That's good, okay. Thank you. Okay. Your chest actually sounds clear. So that confirms that the cough really is just isolated to the upper respiratory there, where it's just all tickly in the back of your throat. Okay. Good. Okay. I don't expect there to be any problems with your lymph nodes relating to this, but I will just check them while I've got you here, because it has been a while since you've been to see me, isn't it? Yeah. Okay. So I'm just going to check the nodes in your neck first, okay? Great. Just relax for me, okay? All right. Okay. And just across your shoulders there. Okay. So I'm just under the jaw. That's all fine. Super. Okay. I just want to have have a little look up your nose with the otoscope. Okay, so it should be shining this little light just up your nose. Have a little look to make sure there's no real redness, okay? Alright. Can you just tilt your head back for me? Okay. Okay, and this side. That's great, okay. And I'll have a little look just in your ears. Okay. Just going to pop the otoscope into your ear, okay? Just pull the ear back. Ear's good. There's no redness or swelling in your right ear, so that's good. I'll just have a look on the other side. Okay. So let's just go like that and insert that into the ear. That's good. You got no pain there when I did that? No, okay. I'll just have a little press around the outer part of your ear just to make sure. Okay, so just, there we go. Okay, and this side. There's no pain or tenderness, no. Okay. All right. Good. Okay. Just give those eyes a little dab again. Okay. I've got actually, I've got some drops which I'm going to prescribe for you for your eyes. But you're the fourth patient I've had in today with hay fever symptoms. So I'll pop a couple of these drops in because this will make them feel a lot less irritated very quickly. Okay. Okay, let's pull your eye down and you look up for me. Alright. Okay, there we go. There we go. And one more. Yeah, great. Let's do the other eye. Okay, again, I'll pull your eye down and you look up. Okay, look up for me. There we go. Great. Okay. All right. Let's have a look around those now. I'd like to see a reduction in the swelling there soon. I'd think we'll get that once we start you on the proper medication. That puffiness will calm down. Okay. All right. Just remove my gloves. How are those eyes feeling? Good. So have you not taken any antihistamines or anything? No, okay. You were waiting to see what I said. That's good. Well, I'm going to prescribe you antihistamines. I think that... Are you still working? Okay, so I'm not going to prescribe you one of the sedating ones, which are more effective. But if you need to be at work or driving or, operating any machinery, equipment, then sometimes the first generation of antihistamines, they are quite sedating, although, as I said, they are the most effective. So I'll prescribe you something that isn't going to make you drowsy, okay? All right. Just find my prescription pad underneath everything else. Okay. So we'll do, let's have a look. Okay. Those. Okay. And you can take these 3 times a day. Okay. So that's that first one. And secondly, I'm going to prescribe you a nasal spray. Okay. Now the nasal spray, it won't work straight away. It might take a week or so to start taking effect, but it actually helps with a lot of those symptoms. Okay, so I'll do that. But you'll only need to use that once a day. Okay. And then the eye drops. 3 times a day on the eye drops. Okay, let's just sign that. Okay. Seems a little strange writing prescriptions because we normally print them out, but as I say, everything seems to not want to work today. So, okay. So, there's your prescription. Great. Okay. Can you see okay now? Your eyes cleared after those drops? Good. All right. If you've had no improvement after a couple of weeks, then do come back. But I'm quite convinced that you are suffering with the seasonal hay fever allergy. The grass pollens are very high at the moment. So you've probably got another several weeks of the pollens being high, but obviously they can fluctuate with the weather, so you might have days that you feel better than others anyway. But you're fine to take all this throughout the hay fever allergy season. Okay. Well, take care, and I hope you're feeling much better soon. And come back and see us if you're not. All right then. Take care. Have a good day. Bye-bye.